Hi everyone, this is Dr. Jeff at Atlas Health, and I want to show you something on an MRI about a principle that we were talking about, the nature of when people get lower back pain. And one of the things that we mentioned was that your spinal cord actually does not go all the way down to the bottom. What it does is it ends kind of in the mid-small of your back, and then what it is just a bunch of free nerve roots. And so what we've got here is we've got an MRI scan. We're looking at basically a top-down approach through the vertebrae right here. And the white area, this is the opening where your spinal canal would be. And I want to illustrate all of these little black dots. What these are is these are the nerve fibers called the cauda equina that are going off of the base of the spine, and then are going to be going down, like a series of rootlets like this into the parts of the lower back. So they're going to be going down, and then wherever they so exit the spine, that is where they're going to be exiting out through the side like this. So I'll just start doing a little bit of movement with the mouse. So what we're doing is we're going progressively and smaller down. And what I can also show you is that when and if you have bulging discs, yes, it could be a source of irritation potentially for these nerves. But I want you to also consider that it's going to be creating tension more appropriately on how these nerves attach on the spine. So a lot of times people do have bulging discs in their back, but in and of itself, these little nerve rootlets might be able to move behind it, but it can produce tension, pulling, and all that sort of stuff up into the very top, so a person can get headache, migraine, low back pain, sciatica, all that sort of stuff because of a problem at the very bottom or also at the very top. So as we keep going down, oops, sorry, I went the wrong way there. As we keep going down, you see, okay, there are fewer of these nerves now, which would make sense. So now we're into the pelvic area, fewer nerves, and then all the way down at the bottom, we have only the one. This is the one that we're talking about. It's called a filum terminale. And what it is, and this is to illustrate when we're talking about spinal cord, your spinal cord is a loose piece of string anchored at the top and anchored at the bottom. And so this connection at the bottom, if there is something that is pulling from either the top or from the bottom, it's like pulling the string in either direction. So you can have a problem in the neck, and if it's misaligned there, it's going to tug and create tension on this part right down at the very bottom, and potentially be putting irritation through any and all of these nerve roots because of their connection up to the spinal cord at the top. In other words, you can get low back pain, sciatica, pelvic pain, and all kinds of other neuromuscular issues in the lower back from what's going on in the neck. So just saw this little video, or just saw these pictures here and thought, this would be a good opportunity to show you a little bit about what we're actually talking about with some of the anatomy there, and again, what's actually going down in the back, and again, how the neck can be creating some of the lower back issues. Thanks for watching this one here. This is Dr. Jeff at Atlas Health.